Hello and welcome to the Women's Centers. My name is Khadijah and I am a patient advocate. Today I'm going to talk to you about the medication abortion, also known as the abortion by pill. After watching this video, you will meet privately with the advocate who can answer all of your questions. You will also be giving take-home instructions with all of this information written down for you. The medical abortion consists of two medications. The first medication is a pill called Mifeprex, which is taken today in our office. The second medication is called misoprostol, and the doctor will give you 4 misoprostol pills that you would take at home in 24 to 48 hours. Today, your healthcare provider will give you a Mifeprex pill that you will swallow with a cup of water. This medication blocks pregnancy hormones and stops pregnancy growth. There are not usually symptoms with this medication, although occasionally people report bleeding, cramping, nausea, or fatigue. It is recommended to wear a pad or panty liner as precaution. Most people are fine to go about their normal day from now until they take the second medication. We recommend filling the prescriptions we give you today, as well as making sure you have overnight maxi pads, a thermometer, and a heating pad or hot water bottle at home before you take the second medication. At home, you would take all 4 misoprostol pills at the same time 24 to 48 hours after you took the Mifeprex pill. Instead of swallowing the pills, you would put 2 pills on each side of your cheeks in between your gums and lower jaw, and let them dissolve for 30 minutes. After the 30 minutes, if the pills aren't fully dissolved, it is okay to swallow the rest with water. Please do not eat or drink anything while you are letting the pills dissolve. If you are experiencing vomiting after taking the 4 pills, they will still be effective if they dissolve for the full 30 minutes. In some cases, a patient may be advised to take the 4 misoprostol tablets vaginally and will be giving alternate instructions. The main side effects of the misoprostol includes bleeding, cramping, and passing clots. These side effects are normal and mean that the medication is working. Experiences vary from person to person. You could start bleeding immediately, so we recommend putting on a thick overnight maxi pad before you take the 4 misoprostol pills. If you do not experience the bleeding right away, you should begin to experience it within the next few hours. Once you begin to experience bleeding and cramping, it is usually most intense for about 2 to 4 hours. After misoprostol, you may experience nausea and or vomiting and possibly diarrhea. These are normal side effects and usually last only a couple of hours. It is also normal for you to experience none of these side effects. Most women resume normal activity the following day.
Hi, my name is Taylor and I'm here to talk with you about treating symptoms and warning signs. If you're experiencing pain and cramping, there are 2 different medication options for pain. The first option is ibuprofen 800. This is the same as over-the-counter ibuprofen, except it's a higher dose. It is the same as taking 4 over-the-counter ibuprofen tablets. The second medication is acetaminophen 1000 milligrams. This is the same as taking 2 over-the-counter extra strength Tylenol. These pain medications can be taken on their own for mild pain and can also be taken together at the same time for moderate to strong pain. We recommend taking the ibuprofen 30 minutes before you take the misoprostol pills at home. If you're nauseous, you can take an anti-nausea medication and have a light meal at this time. We recommend taking your pain medications regularly as prescribed to avoid an increase in cramps and pain. The pain medication should help to lessen your pain, though it may not eliminate the pain altogether. Please do not use any medication with aspirin for at least 1 week after your visit. Other remedies for cramps and pain include using a heating pad, taking a hot shower or plain water bath, drinking hot liquids like tea or hot water, walking around if you feel uncomfortable, and massaging the abdomen deep below the belly button. Drinking plenty of fluids is also an important part of managing cramps. If the cramping or pain does not lessen with the prescribed pain medications and the above remedies, please call our office. Bleeding varies from person to person, but most people experience the heaviest bleeding in the few hours after taking the misoprostol at home. The bleeding and cramping should then decrease and feel similar to a period for about 5 to 10 days afterwards. You can also experience bleeding off and on for up to 8 weeks. You may notice that your next period is heavier than usual, and this is normal. You should call us if you experience heavy bleeding, which is fully saturating 2 overnight pads per hour for 2 hours in a row. Please note that passing clots is normal, and that clots can sometimes be as large as an orange. If you have been feeling nauseous as part of your pregnancy, you should notice the nausea going away over the next 24 hours. Please ask us about an anti-nausea medication that we can give to you while you're here at no cost to you. We can also give you a prescription to fill at the pharmacy. You can also purchase an over-the-counter anti-nausea medication at the pharmacy. We have a nurse on call 24 hours a day, 7 days a week. So if you have any questions, or if you do not know if what you are experiencing is normal, please do not hesitate to call. If you call after business hours, please follow the voicemail instructions. Leave a detailed message, and the nurse will return your call within 20 minutes. Infection is very rare with the medication abortion, so it is very unlikely you would need antibiotics. However, an early sign of an infection is often a fever. If your temperature reaches 100.4 degrees or higher, please call the center's emergency hotline. We recommend that you do not insert anything into your vagina for at least 1 week. This includes using tampons. Finally, if you are feeling sick or having nausea, vomiting, diarrhea, or weakness for 24 hours or more after taking the 4 misoprostol pills, please call the nurse.
Hi, my name is Jen, and I'm going to talk to you about follow-up care. When you meet privately with your advocate today, they will schedule your follow-up appointment. The follow-up is the only way that we know that the medications worked properly, so it is very important to come back for this visit within 7 to 14 days. There is no charge for this appointment. It is included in your fee. It will be a quicker appointment where you will have another ultrasound. Your healthcare provider may choose to do a transvaginal ultrasound to get the best view of your uterus. Sometimes, even though the medication has worked, there can still be tissue or clots in your uterus. You should eventually pass this on your own, though your healthcare provider may recommend additional medication or treatment, depending on how you are feeling. Rarely, the medication can fail, and in that instance, you could either repeat the medical abortion or have an aspiration procedure. If you're interested today in contraception, we can give you a prescription for the pill, the patch, or the vaginal ring. If you're interested in long-acting reversible contraception, like Depo, the IUD, or the implant, please ask a staff member if that method is available at the center, or we can provide a referral. You can also purchase emergency contraception, known as the morning after pill, or take home a prescription to keep on hand. We will provide additional information on any or all of these methods, as well as when to start any of these methods. We are available to help you choose what might work best for you. An advocate will meet with you privately and address any questions you may have. Thank you for choosing the Women's Centers.